Thank you, Madam Chairwoman, and thank you to our witnesses for testifying today. Now, I appreciate the objectives that are named in the title of this hearing: improve health care coverage and provide lower costs for families. That sounds like the Affordable Care Act to me, and certainly the more than 2,600 people who showed up at a healthcare town hall meeting I had with our senators recently share that sentiment. We've talked a lot about small businesses here today. Mike Roach is the owner of Paloma Clothing in Portland, Oregon. He said, "I greatly benefited from the ACA during the years it's been in place, and I wish more of us had spoken up loudly so that the public, Congress, and the President had a better understanding of that." He said that the ACA helped to slow the rising of insurance premiums for his small group of covered employees. In my home state of Oregon, nearly 1 in 5 individuals had no health insurance coverage before the ACA. I used to years ago do financial counseling at Legal Aid, and many of the people who came in thinking that they really needed to file bankruptcy were there because they had medical bills. They either had no insurance or inadequate insurance. Today, more than 95% of Oregonians are covered, including about 56,000 children and low-income working adults in my district who benefit from the expansion of Medicaid. So, Ms. Mitz, Oregon has done a lot of innovative work to provide coordinated care while reducing costs, and this is true not just in urban and suburban areas, but in rural areas as well. Our coordinated care organizations are doing amazing work with coordinating healthcare, mental health care, vision care, dental care, working with early childhood, and really seeing great results. So I know you, in response to Mr. Polis, talked about the proposals such as block grants or per capita allotment and how that might affect those efforts. I wonder if you could talk a little bit about geographically, how would this affect rural areas in terms of if there were block granting or per capita, how would it affect the rural communities where there are jobs there and increased access because of the Affordable Care Act?
Thank you for your question. In the world of per capita caps, there would likely be huge enrollment cuts or benefit cuts that would have a detrimental impact on rural communities' access. Rural communities have benefited immensely from the expansion of the Medicaid program, and you would see fewer people enrolled. You could see them losing benefits. You could see them having a harder time finding a provider because they have provider rates that they have to cut. And the real challenge of it is that it really leaves states holding the bag, like Oregon, who want to do innovative things and who have had the resources to do those innovative things and make immense progress in improving care coordination, quality of life for people. They won't have the resources to pursue those types of innovative strategies to connect medical care to community-based services anymore.
Thank you. I know my constituents are extremely concerned about it. And Ms. Mitz, the ACA included, as we know, unprecedented new consumer protections for patients, such as eliminating annual and lifetime limits, preventing insurers from dropping people when they get sick, charging women higher premiums. What will happen to these protections in association health plans?
Under the bill put forth to you today, those association health plans would no longer have to comply with so many of those rating protections that have been a huge benefit to many small businesses that before the Affordable Care Act actually had a really hard time finding affordable coverage for their employees because they employed employees who actually had healthcare needs, who were maybe older, and the market didn't work for them before. And so we would move back to a situation where we'd have a segmented market and people who were healthy and pristine health could move into an association health plan. I think the thing that's important to keep in mind is that that doesn't mean that association health plan would always be there and work for that small employer. If their workforce got older, claims went up, they might find that that association health plan charges them more, and it's not a viable option for them anymore. Can
you address, I know there have been some solvency concerns about some of the association health plans. Can you address that concern?
Yeah, there's historically been concerns about association health plans not having adequate solvency funds. They have leaner, less rigid requirements than typical health insurance coverage. Partially, state oversight was added to that to help address some of these problems. The bigger problems were when they were just under ERISA. And when a plan goes insolvent, an association health plan goes insolvent, their employers and their workers are still left with all of those unpaid medical claims and them on the hook for them. And if the plans are not under state jurisdiction, they won't be able to benefit from state guarantee funds that help pay those claims, so they'll be left on the hook for them.
Thank you. I see my time has expired. To yield back. Thank you, Madam Chair.
Thank you very much.